Hey everybody, I am going to teach you guys about how to perform a physical assessment on a pediatric patient. Today I have Corian with me. He is 9 years old. And first things first, we're going to start off by getting the weight. And the reason why we get weights are very important with pediatric patients because the medication dosing for the doctors. So we always like to get an accurate weight so we can make sure they're getting that accurate dose of medication. So stand up for me. $45.4 kilos. All right. I want you to turn around for me so we don't get a height. He's right at 50 inches with his hair. All right, Corey. Sit back down for me. So, I'm also going to get a set of vital signs on him. And the reason being, I know everybody should know how to do vital signs by now, but the reason being is that with pediatric patients, their vitals are completely different from the adult patient. So take in consideration their respirations, their heart rate, and even their blood pressure. They're going to be completely different. So you need to know how to distinguish the two. So make sure you look in your book and make reference to those normal ranges for kids. So here we go. Alright, perfect. Your blood pressure is actually really good this time. I think he was nervous the first time. Mom, it is 105/7, so he was like 130/7. Alright, so with pediatric patients, you also want to pay attention to the parents and see how they're interacting with the kids because you can tell, you can sometimes distinguish if there's kind of like issues at the home or whatnot. So she's attentive to him, and she's a very good mom. All right, so we're gonna start from the head to toe. So like, just in general, we're just gonna do a general look at his appearance and look at his hair. We're gonna check his hair for any sort, anything like that. He looks good, and we're also gonna palpate his lymph nodes. So. And you shouldn't be able to feel them. If you do be able to feel them, that means he has some kind of lymphopathy. I can't say the word, but you know, just look. All right, Corey, you're in. Pay attention to my finger. I want you to follow it. Do not turn your head. Just follow with your eyes, okay? Alright. One more time. Alright. Pupils are reactive to light and accommodation. Sit back for the quarter. I'm gonna listen to his lung sounds. Deep breath. Lung sounds are clear. Alright, let that for me one more time, Corey. Now I'm listening to his heart. Next, I'm going to do abdominal assessment of the abdomen. I cannot talk today. I don't know what's going on. But the first things first with the abdomen, you never touch first. The first thing you do is inspect. So you're going to observe. You're going to look at his abdomen, see if you see anything protruding, any ascites or anything like that. And the next thing you will listen. So with listening to the abdomen, there's 4 sites. And you go in this sequence. Right upper quadrant, left upper quadrant, left lower, right lower. Alright. Bowel sounds are active. Next things next is that you palpate, and you start off with the light palpation. So I'm just gonna palpate his abdomen for any tenderness. Are you hurting anywhere? Alright. In addition to the abdominal assessment, sometimes people, doctors mostly, percuss and try to palpate the liver. If the liver is palpable, there's something wrong. So that's gonna warrant for additional assessments. But anyway, we're gonna scoot on down and go to the musculoskeletal. So stand up for me, buddy. Alright, so I want you to touch your toes for me, okay? If you can. Can you bend your legs? We're checking for range of motion, arms, fingers. Good job. Alright. Alright, sit back down for me. I'm going to see about your resistance. So, just like we did earlier, you're going to push back for me, okay? Alright. Good job. Alright. So, it looks like you're pretty good, bud. Mom, do you have any questions?
No, I don't have any questions.
No questions? Alright. Well, the big thing with pediatric patients is that you pay attention to their vital signs and you make sure you get their weight. Also, talking to mom, a lot of times, depending on the age, kids can't communicate with you. Like Courtney, he's able to tell me what's wrong, and he can tell me if there were some issues going on at home. So you just kind of gotta look for signs and cues. So make sure you pay attention when you're taking care of kids like that. But first, always establish your rapport with the parent, the caregiver, because this is where you're gonna get your health history from. And that's it.